5 silent killers. These are the 5 killers that my staff identified. Some of you have experienced some of these things, and hopefully not all of these things, but chronic kidney disease, hyperthyroid disease, diabetes mellitus, cardiac disease, and cancer. One of the ones that is the reason why I say there's this debate about protein in cats. I see a new diabetic cat every week. So the question out there, one of the things we do to treat diabetes mellitus is put them on a high protein diet so they don't have a lot of carbohydrates that have to be processed by this pancreas that's not working properly. And so people began to ask, well, if it's type 2 diabetes and just like in people, they have too much sugar in their system and it's burning out the pancreas, that would seem to be what's happening in cats. And maybe if they're eating Purina cat chow, they have too much carbohydrate in their diet. Any of them, I just picked on that one, but maybe just the standard foods out there don't have enough protein for a cat. And indeed, if you need 50% protein to run your body, and you're only getting 30% protein in your food, then you're going to have to eat another third of food to get the protein you need. And now we've got not only the normal carbohydrate that was in your food, but you've got an extra carbohydrate because you've had to eat more to get what you need to live. Maybe that's why we're burning out. And so probably all of you have heard me say or have had the list of the 3 high protein dry foods that are out there right now. Most canned foods are very high protein. So if you're doing a dry food and a canned food together, you're probably accomplishing the same thing as a dry that's in the 50% range. A mouse diet, who does this research? A mouse diet is 45% protein. So the cats in the barns don't get diabetic. That was one of the things that they used, and they did a 50, 40, 30, and 20% protein in cats, and they found almost no diabetes in the 50% cats, 30% diabetes in the 30% cats. It was a small study. The larger study is actually already started, but it's going to take the lifetime of a cat to be able to know the answers to that. So we're going to know something more in 10 to 15 years, and I think it will support the higher protein diets that we're talking about. And that'll have to be repeated someplace else, but I think we've got some things happening that are going to support that. So we're gonna drink a lot and urinate a lot because we have a lot of sugar floating around our body that we can't use. So diabetes mellitus is about not making enough insulin to process the sugar that's in your blood. And insulin is like the doorkeeper, the gatekeeper to a cell. So it stands there and it opens the door to let energy into your cell to run. So if you don't have any insulin, it is very hard for the energies to get into that cell to run the cell. And you have all this sugar floating in your bloodstream, where your body says, well, that's not supposed to be there, so your kidney gets rid of the sugar, and as it gets rid of the sugar, it pulls water through it with it to dilute the sugar so you don't have, pure sugar urine. And so you're thirsty, so you're drinking more to try to replace that. And that's what diabetes is really about, that gatekeeper of insulin. And that's why you give insulin, because you're not making enough, hoping that you can get that gatekeeper to work and feed your cells. That's why you may look overweight, but you're going to lose muscle in cats because they break down their protein into sugars, and that's how they get their energy. And so they're going to pull protein from their body to try to make more sugars because they think they're hungry. Their cells think they're hungry. We need more. We need more. Well, they can't get it in. It's not that they need more, but that's what the body tells them. And so they pull protein from the muscles. Think about what that's doing and the burden on the kidney, trying to get rid of sugar and extra nitrogen, because you're breaking the protein down into sugar that we can use and nitrogen that we have to get rid of. They are just ravenous most of the time. At some point they decrease their appetite because they just get toxic again. They get lethargic and weakness because their cells aren't getting what they need to run. And they do a really interesting thing because the brain cells say, whoa, wait a second, we need food. And so they send a message to the body, to the liver, to say, make us some food. And the body is able to make ketones, which don't need the gatekeeper. They'll go through a cell and serve as energy. But ketones are an alcohol. And so you basically either have a dumb drunk or an aggressive drunk because they're running their brains on alcohol. And I had one really dramatic one several years ago, and that's how they could tell that they were in balance, was their cat would get really, really mean when the sugar wasn't, the insulin wasn't regulated well. And as soon as they got the right insulin going, that cat was up on their neck, loving it. So it was very, very dramatic in that cat. They will sometimes vomit again. That's a lot of that's just toxin buildup. You can sometimes catch a sweet breath, and I'll show you the abnormal walking. In most cases, we use Mellitus in cats because it stays in their system a little bit longer. The normal human insulins are broken down much more quickly in a cat. And if any of you guys know any diabetics, Humulin N in people that will last like 12 hours in most people, lasts about 4 hours in cats. So you'd have to go in every 4 hours and give an injection, which you could, but Mellitus is gonna last you for in that 12-hour range. Most cats you have to do two injections, twice a day. This is the breakdown of the nerves. And so this cat really will never walk up straight. He's going to walk with that plantar. It doesn't hurt him directly, but he's not going to be as active because he can't be. And he can make those muscles a little more tired. So they will sometimes have just muscle aches because they've got that abnormal angle. And obviously that's not really good for the joints either because that's not the way they were put together. So arthritis is a secondary possibility in these cats. You can even see a little breakdown in this cat. In the front, this is Fluffy, and they're just thirsty. They're just thirsty when they first start out. Of course, I have a cat that will only drink out of the fountain. So these are the cats that we are really prone to them because they've eaten so much extra food to get the protein they need, and so they're really, really fat, and that sugar is burning out the pancreas. Type 2 diabetes. A couple of things we can use here. These are some of the prescriptions ones, MD and DM. I think that's interesting that they got flipped back and forth. Those are really high protein diets. We can also use the 50% protein diets that are out there too. So hopefully if you're feeding a high protein diet, you'll never have to deal with this. This is really one of the ones preventable. But if you do, you may not have to change diets too much. And this is the insulin and the needles that you have to do with these guys. So treatment of diabetes, we start with low-dose Mellitus, and we slowly introduce a high-protein diet because they don't know what they should be eating. They check the blood glucose and fructosamine. Fructosamine looks at what the blood glucose was over 2 weeks. And the problem with cats is I can bring a perfectly normal cat in here and draw blood, and their stress level throws their glucose up to 200 or 300. And they're not really diabetic. And so we have to be aware of the blood glucose may not be real in a cat, but the fructosamine will be. It's going to look at that average. So if you've had a one-time stress peak, your fructosamine for 2 weeks isn't going to be affected. So that's a really good one to look at. And then we monitor their blood glucose and fructosamine periodically and adjust as we need to. I just worked one off of their last insulin. We just slowly worked them down off of insulin because they had been eating the high protein diet, lost some weight, the cat was doing well, and presumably if it keeps on the high protein diet, we will not have to do insulin again. Although those cats are in somewhat of a problem situation in stress situations like a disease process. Sometimes we have to go back in for a short time with insulin in those cats that have been diabetic at one point. because the stress of a sickness will throw their blood glucose real high too. So we sometimes have to periodically treat those guys.